Oh, ini katanya kuliah ini Prof Noran ya? Bener kah? Oh iya betul. Selamat sore Prof Hasrin. Ini baru berapa orang ini, Mbak Ajeng? Halo?
Assalamualaikum dan selamat sejahtera semua.
Assalamualaikum Prof Hasrin.
Salam, Prof Santi, apa kabar?
Baik, Alhamdulillah. Senang sekali bisa ketemu meskipun lewat Zoom ya,
Ya,
Prof Hasrin. Gimana situasinya di Malaysia?
di Malaysia sekarang sudah boleh merentas desa, boleh merentas negeri, mulai 11 Oktober hari itu. Tapi gasnya sudah meningkat sedikit dan terpaksa baginya dos booster.
Oh, case-nya naik lagi.
Tak banyak lah naiknya, ada naik sedikit sebab sudah ada pergerakan kan. Jadinya sehari sekarang dalam lebih kurang selama 5 hari kurang daripada 5.000 satu hari.
Ya. Itu sama seperti kita di bulan kemarin Juli, Prof. Kita di bulan Agustus 5.000-an.
Betul
Terus
sekarang?
turun. Sekarang kita 600 something lah.
Per day untuk satu negara?
Per day, iya per day.
Oh, oke.
Kita sudah turun.
Tapi tidak dibuka lagi kan untuk semuanya? Sudah dibuka.
Sudah. Kita sudah buka lah. Makanya itu kita sekarang pengawasan ketat, monitoring terhadap kepatuhan.
SOP-nya.
Ya, kepatuhan protokol kesehatan.
Ya.
Pakai masker, jaga jarak, situ.
Sini pun masih lagi, tapi sebab sudah 93% dewasa atas usia 18 tahun sudah dapat complete vaccination.
Iya. Vaksinasinya bagus ya. Kita vaksinasinya untuk 2 dos masih 40%.
Di sini sudah 93.
Oh, bagus gitu. Lah kok masih tinggi ya kasusnya?
Ya, tapi kasusnya masih mild.
Oh, banyaknya mild.
1 dan 2.
Oke, iya. Banyaknya mild ya, Prof ya.
Ya, tapi nanti Prof Noran nanti akan ceritanya lebih lanjut lagi ya.
Iya.
Hari ini saya ceritanya COVID dan makan-makan. Prof Noran cerita semuanya COVID. Nama pun tak apa.
Assalamualaikum, Prof Noran. Belum di mute, unmute, Prof.
Sorry. Iya. Waalaikumsalam warahmatullahi wabarakatuh.
Gimana kabarnya? Baru ketemu saya ya pertama kali nih sama Prof Noran. Prof Hasrin berapa kali ya setiap ke Surabaya pasti ketemu.
Ya, satu masa nanti Prof Noran pun kena ke Surabaya, bawanya juga ke dalam kapal selam itu ya. Iya.
Ada kapal selam di Surabaya ya?
Wish ada cerita kenapa Surah dan Baya tuh, tapi tak boleh cerita sekarang.
Oke. Ada makna.
Ada makna.
Ada maknanya, ya.
Karena sampai Surabaya baru tahu. Kalau tidak sudah ketemu waktu EPEC ya, tapi tak apa, minggu depan EPEC kami.
Iya, minggu depan EPEC, iya. Tanggal 27-28, Prof Hasrin mulai 26 malah ya.
Ya, 26 ya. Noran, cases-nya di Indonesia 600 lebih saja sekarang.
Oh, bagus lah.
Iya,
Kami di Malaysia masih tidak begitu
masih
bagus
ribuan
lagi.
ya.
Ya,
Masih
masih
ribuan.
ribuan. Masih ribuan.
Masih
Uh,
ribuan.
lebih 5.000 lagi.
Iya, iya, saya lihat di dashboardnya WHO. Kita turun di bawah 1.000 itu sudah 2 mingguan ini.
Oh, Alhamdulillah.
Iya, tapi kita ini kan menghadapi tahun baru ya.
Iya.
Pergerakan orang ramai kan.
Mhm.
Itu yang kita takutkan. Dan sekarang sudah buka semua, open public places,
Mhm.
bioskop sudah buka.
Sekolah pun.
Sekolah masih belum full, masih satu anak seminggu sekali datang ke
Oh,
sekolah.
okay.
Iya, belum. Tapi kita pengawasan juga di sekolah, jadi random check untuk antigen swab itu.
Right.
Iya,
Kami di sini
ini.
pun baru je buka awal bulan Oktober.
Ya,
Nampak cases semakin kurang, tapi kebelakangan ni semalam pun baru di-announce ada tempat-tempat seperti di Selangor, di wilayah tempat yang ramai penduduk, cases sudah mula naik balik. Jadi itu yang agak
iya,
merisaukan lah.
betul. Iya, ini ya. Padahal imunisasi di Malaysia sudah bagus ya, Prof ya.
Ya, imunisasi sudah tinggi, tapi masalahnya kami kes aktif tu memang dari dulu ramai lah. Nak dikata kes aktif tu lebih dari 5 angka. Jadi walaupun vaksinasi dah elok, tapi kes aktif kira apa nak dikatakan berleluasa kan. Jadi
Ya.
senang orang nak dapat lah.
Tapi kebanyakan kasusnya ringan mungkin ya, Prof ya.
Ya, ha.
Itu yang
Alhamdulillah sekali
penting
yang
ya.
yang dapat dilihat lebih kurang 70% kategori 1
Mild.
2 mild, tapi cuma sebab remaja masih baru divaksinasikan,
Ya.
yang dirisaukan kes di kalangan remaja dengan anak-anak yang belum mendapat vaksinasi lah, yang itu mungkin agak merisaukan lah.
Iya, untuk buka sekolah ya.
Ya,
Persiapan
betul.
reopening school.
Ya. Dan school akan di-open bulan depan.
1
November.
November. 1 November. Tapi sekarang
1
sudah
November.
pergi. Sekarang sudah pergi yang usianya 6 tahun sudah pergi di Taska.
Iya.
Dibukanya secara peringkat.
Iya. Sekolah ini kampus sudah buka.
Sudah.
Sudah buka.
Full atau with small or limited number atau full.
Hybrid juga, campur lah.
Oh, hybrid. Ya. Jadi yang masih di luar kota lewat online ya.
Iya, betul.
Oke, ya. Di kita masih fully online. Ini kita rencana ya bulan depan hybrid, yang datang ke kampus hanya yang di Surabaya yang boleh datang ya. Ya, yang lain masih online ya. Pak Trias, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam, Bu Santi. Assalamualaikum, Prof. Hasrin, Prof. Noran. Thank you for coming and sharing with us.
Waalaikumsalam, Pak Trias. You're welcome. Bisa.
Ini Pak
Thank
Trias
you,
ini.
Prof. Noran, is for a short notice of becoming adjunct professor. Only like for a few months, we already have 3 publication, Bu Santi, Prof. Noran.
Oh ya, alhamdulillah ya, terima kasih.
Prof. Hasrin already a lot. We needed wait for the pre-conference after this. Yes.
Prof. Hasrin,
thank you, Prof.
Hari ini ada lagi satu lagi Pak Trias, satunya lagi acceptance. Nanti saya forwardnya.
Alhamdulillah. Tahniah Pak Prof. Hasrin.
Ini dimulai Bu Lucy?
Iya Bu, silakan.
Kita mulai aja ya Prof ya.
Boleh.
Nanti sambil mahasiswanya ketemu apa namanya?
Boleh.
Silakan moderatornya. Mbak Helmi Putri.
Ya, baik, terima kasih Ibu.
Okay, well, good afternoon, ladies and gentlemen. Best wishes to all of us. Today is such a really great honor for me, Azara Helmi, as the moderator of this event, to be standing here and welcome each of you in this event. Okay, well, thank God Almighty, because over the blessings and graces, we can gather at the very event we later look forward to, namely the epidemiology webinar with the topic, Maintaining the Health of Elderly During this COVID-19 Pandemic. Okay, first of all, I also would like to warmly welcome Professor Dr. Noran Bachelor of Medicine, Bachelor of Surgery, Master of Public Health, Doctor of Philosophy, and Fellow of Public Health Faculty. And also Professor Hazrin bin Abdul Majid, Bachelor of Science Dietetic, Magister of Nutrition Dietetic, Doctor of Philosophy. Yeah, Professor Noran, Professor Hazrin, thank you so much for joining all of us here. It is such an honor to have you as our speaker today. Thank you so much for joining all of us here. Okay, furthermore, I also would like to warmly welcome the Dean of Public Health Faculty, Universitas Airlangga, Dr. Santi Martini, Dr. Magister Kesehatan, the honorable lecturers of Universitas Airlangga, and of course, all the honorable participants of this event. Okay, well, ladies and gentlemen, now we're headed to go to our next sessions, which is the speech from the Dean of Public Health Faculty, Universitas Airlangga. To Dr. Santi Martini, Dr. Magister Kesehatan, time is fully yours.
Thank you, Putri. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Our honorable speakers today, Prof. Hazrin and Prof. Noran, and also our students, and also for the lectures today. I would like to thank for everyone who joined with this guest lecture today. And I would like to thank also for Professor Hazrin and Professor Noran, who provide your time today, sharing your knowledge with us about elderly and nutrition and about COVID-19. I think this topic is very interesting because in Indonesia we are also facing with the number of aging group in Indonesia. So this is very important to know how to handle this group in the next or in the future. Yeah. And also COVID-19, as we know, we are with COVID-19 since last year, and we also know that the COVID-19 has not been disappeared from our life. So I think it is very important for us how to live together with the COVID-19. But actually in Indonesia, the number of COVID-19, as I said before, is decreasing since September, I think. Yeah, since September, and since 2 weeks ago, the numbers is less than 1,000. But we are still have to give more attention about this pandemic, because in the next 2 months we are facing the what we call is a New Year and also Christmas. Everybody, I think the high movement of everybody. So we still have to give high awareness to comply with the health protocol. So that's why everybody in Indonesia, I think, has to have or must have awareness or must have comply with wearing masks, and also to apply physical distance. Yeah. Hopefully in the next year, we did not face again with this pandemic. I don't know that this COVID will be endemic or not, but we hope no have the virus, yeah, in everywhere in the world, yeah. Okay, once again, I think the student wait for the material lecture from you, Prof. Hasrin and Prof. Noran. So once again, thank you very much for your time to share with us, and hopefully we can meet you in person in Surabaya, and also we can have more joint activity, yeah, with you, not only about lecturing. Maybe in the next we can have joint research, yeah, because our university now is provide more funding to do research and to offer collaboration with our partner in abroad, yeah. Okay, thank you very much, and also thank you very much Bu Lucy and also the committee to provide this lecture in this afternoon. And thank you also Pak Trias for your coming and join with this lecture. And student, please keep stay until this lecture finish. Okay, wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Waalaikumsalam warahmatullah. Okay, well, thank you so much, Dr. Santi, for your insightful speech. Okay, well, ladies and gentlemen, now we're going to go to our next session, which is the presentation of our first speaker with the topic nutrition and recovery for the elderly. That will be delivered by Professor Hasrin. Okay, but before that, I would like to read the curriculum vitae of our first speaker. So to the committee, you can do your own screen sharing now. For the International Honors and Award, Professor Hasrin got the award of Best Oral Presentation in the 10th Annual Malaysian Rehabilitation Medicine Conference. And Professor Hasrin also becomes an adjunct professor in Universitas Airlangga, and he also becomes a visiting scientist at Harvard Chan School of Public Health. And Professor Hasrin also got his doctorate degree in King's College, London. Okay, maybe that's all from the brief reading for Prof. Hasrin's curriculum vitae. So yeah, without any further ado, time is fully yours, Professor.
Okay, thank you very much, moderator, Ms. Azza, just now. And thank you so much to Ibu Santi for a very nice welcoming speech just now, and Pak Trias, and definitely to all family members of University Airlangga for having or providing the platform for us to give the talk today. But nonetheless, this wouldn't be possible without the communication together with Dr. Lucia, who have been very helpful to actually put things together. So there is a bit of a change. By right, it's actually Prof. Noran to start with, but I shall start mine with the COVID-19 pandemic, nutrition and recovery for the elderly. Everybody can see my slide? Is it all right?
Yes, we can see your screen, sir.
Okay, brilliant. So what do we know when it comes to, we have been learning a lot for the past 18 months. And during this pandemic, some of us actually have been stuck at home, not doing much, and some have to go out. So for my outline presentation today, I will talk a little bit, because we are talking about for elderly or older adults, or in Indonesia, we call it lansia. Even though I haven't been to Indonesia for quite some time now, I still have a little bit of Indonesian words that I still remember. So nutritional issues among older adults for my talk today, diet and lifestyle during pandemic, what we have and seen from other studies, obesity and sarcopenia, and then at the end will be updates and conclusion for my talk. So before we go and dive in related to COVID-19 and what do they do or affect us, there are several issues in relation to nutrition among older adults. First, definitely with our older adults, there can be malnutrition, under or overnutrition. It's not just about the weight, but also with micronutrient deficiencies, including anemia. When we are older adults, as we're growing old, there are physiological changes that happens to our body. There's some changes with your body composition, your muscles getting less, your body fat is becoming more, or both are becoming less. There's sarcopenia obesity. There is some changes with your taste and smell, or for some of us, even though with hearing and eyesight. For those who are not wearing spectacles, by the age of 40, you start to realize that you need to have your spectacles, okay? So oral, it can be also compromised either via your poor oral health, your tooth loss, or dentures is not being fixed properly. And because you have so much of polypharmacy or medications, that might lead you also to xerostomia or dry mouth. So when you also have these changes, you don't feel like eating, despite the food is so good in front of you. Besides than that, there are some gastrointestinal changes. You might experience some dysphagia, or you might actually having less acid chloric produced from your gut, and constipation, and etc. This come either you are healthy older adults, as well as if you are already having some diseases. Then when you are facing all these challenges in your life, it might affect your quality of life. Thus, you start to see people becoming depressed, they are actually lost their spouse, they're becoming depressed, functionality, they're actually going to be less, frailty, so on and so forth. So have that at the back of our mind, let alone when we are being hit by the pandemic. So you can see how beautiful this is early. I just want to share with you, this is how we look like back then, 11 March 2020, when only the red zones for COVID-19 is very little. But within a split second or split few months, you can see everything is red. All right. And then at the same time, from a dashboard, you can see most of the countries being affected with COVID-19. And then slowly the mortality has gone up as well. So what is known during this time? So what is known during this time, one of the best ways of public health strategies to prevent the pandemic is doing by quarantine and isolation. And definitely that has an effect to your diet and physical activity. So when you are less moving around, you are also trying to reduce the diffusion or infection to prevent the pandemic. What will happen? People tend to move around before. People start to feel depressed. And I know if you read from the newspapers, people start to hit each other for some of the family members. People becoming anxious because this is something that they cannot do, cannot go out. Some people actually release their anger to their family members and increase stress because some actually cannot get their job. And what will happen in terms of food? There are so many things happening in their life, let alone when it comes to food. They cannot move, they cannot get money. So obviously, and they will try to stock up all the food that is possible because they wouldn't be allowed to go out that often. So the food that is always available on the shelf are food that is high in sugar, less in fresh fruits and vegetables, definitely because even though the food that being produced, they cannot cross the border to be sent. And what will happen when you are becoming couch potato? Unhealthy lifestyle, when there is a tendency of reducing physical activity and some people are stressed, the consumption of alcohol going to be greater. So when you look into our obesity is one of the common problem as well, either from kids up until adults to older adults. And before it comes with the COVID-19, obesity has already compromised a little bit with your immune system as shown in the slides, let alone when the COVID-19 infection happen, it will increase in terms of your chronic inflammation. It will also make your immune system dysfunction, but as well as it will also make it in terms of your severity, a disease, or poor clinical outcome. And in fact, what has been noticed from a lot of publications, obesity itself has emerged as a novel risk factors for hospitalization and death due to COVID. And what will happen if you're having non-communicable diseases? Because you know when you're older adults, or even though just adults, you definitely will have any of these, either high blood pressure, diabetes, heart disease, so on and so forth. And what they notice, 1 in 5 people who are at risk, increased risk of severe COVID-19 should they become infected. So the severity is becoming even worse once you're actually having one of the non-communicable diseases. So let's look in terms of the eating habits and lifestyle changes during COVID-19. So obviously during this time, you wouldn't be able to do face-to-face survey, but due to the cannot do the face-to-face survey, so they did online. And this study is conducted in Italy, looking into from within less than 3 weeks. And what do they get from the respondents at that time? And I'm sure in Indonesia as well, during that time, March or April, people are keep on sending to fill up some of those questionnaire in Google form. And I guess more and more we will see publications from the pandemic itself. But just look into here, with these respondents, what do they say? Most of them perceive that they had gained weight during the lockdown. And most of them agree their fresh fish and fruits consumption has reduced because nobody's going out. There's no one going to, no fishermen's going out there to take the fish. So obviously the quantity will be less. And also the surprisingly, when it comes to the group aged 18 to 30 years old, have higher adherence to Mediterranean diet. So not all things are bad. So it is just apparently when they are going back to their house, they cannot do much. They get influenced as well with their what we call it traditional diet, which is good. But this is just to summarize what I mentioned just now. During quarantine and COVID-19, this is purely during quarantine, the diet quality has reduced. So when you reduce your fresh fruits and vegetables consumption, definitely you reduce in terms of your antioxidants taking, as well as food that is low in energy dense has been minimized. What will happen? Foods that have longer shelf life. And longer shelf life are they having higher in terms of sugar, higher in terms of sodium, and definitely higher in terms of trans fatty acid. So let's look into some other studies looking into the changes of diet quality during this COVID. And what do you notice? People cannot go out. So what they do is actually none of them eat breakfast outside so much. So in terms of money-wise, you are actually saving money if you are preparing the food, unless you order Grab Food or Food Panda on the time to come to the doorsteps. So nevertheless, so look into here, as an overall from baseline, people tend to eat outside a lot, but because of the COVID-19, it has reduced in terms of breakfast, people have reduced, and more people are actually eating at home, which is brilliant. And this is published from the work by Lamarck in Canada. So if you look, there's always two sides of the story. There are some changes, but it's up to us to also make some modifications to make it healthy if possible. And definitely, when in comparison to Indonesia, Indonesia is actually half in terms of the overweight populations compared to Malaysia. So Malaysia is always growing very well when it comes to overweight and obesity. And I guess I had shared these slides before, and I think the trend would be almost similar or even more now for Malaysian counterpart. I didn't put here for children. For children, as we are Malaysian is number 2 after Brunei in terms of leading for overweight obesity. So I don't see much of Indonesian is actually in the top 3 ranking. So well done to the Indonesian colleague. So the most commonly used measure of overweight and obesity, we use it with the BMI cutoff point. And what is interesting to see, when you are 65 and older, there's a U-shaped relationship between BMI and mortality. Means that you cannot be too lean or you cannot be too overweight. You just need to be just right so that you are always be in the good health. So aging itself is associated with significant changes in body composition, but definitely when it comes to reduction in fat-free mass. So it means in a short way, I'm just going to say your muscle mass has reduced. Okay, so hence that is very crucial to look after your diet, especially not only just once you are 60 and above, but at any time of your life. So let's go through this. Sarcopenia obesity with aging is always an interplay between sarcopenia and obesity. Once you are aging and if you don't control your food, less physical activity, you are also increased in terms of your abdominal fat. But don't forget, once you increase your abdominal fat, you're not moving around, your muscle becoming weak, you start to lose your muscle, or we can put it in a nutshell called sarcopenia, and you had decline in your physical activity and you reduce energy expenditure. So that going to affect in terms of your cardiometabolic diseases, potentially increase your mortality and increase your physical disability. So all those things are important. I just put it here as a snapshot to look at the body composition as an overall for our body, rather than just focusing on body weight and BMI. There's so many compartments in our body, and focusing would be fat-free mass is the one that we want to maintain to be greater and fat mass to be less. But this varies in terms of your what we call age as well as your sex. Obviously, for female, between less than 30%, but for men, it's actually less than 20%, between 15 to 20. So these would be some of the methods that people normally will use in terms of looking at the body compositions, no longer just looking into your BMI. But bear in mind, for public health purposes, BMI and waist circumference is still a good way of understanding whether we are over what we call it, to look at our risk factors. So I've converted my presentation just now. This is how it looked like as an overall. Your bone and minerals is quite small here, but your skeletal muscle is there, but definitely easily be influenced, because the moment we reduce in terms of your physical activity and proper diet, this will be reduced and you will leach out a lot of your fluid that is attached to your skeletal muscles as well. So as a summary, before we go further, why muscle is important. So muscle is definitely important for our movement, because we cannot move with our weak muscle. And also preventive sarcopenia during elderly, or even though if you're older adults, is actually if you already start to show sarcopenia obesity, is also to delay it becoming even worse. Currently with our work, patients who are older adults who are going for surgery, we will make sure that if they are sarcopenic obesity, we will make sure that they will reduce weight before they go in surgery, and nutrition input and physical activity input. And that is currently happening in our hospital setup. So at the same time as well, predicts all-cause cardiovascular and cancer-related mortality. Okay, my slide is not moving. Let me see. There you go. Besides than that, I think by now, with the number of cases that we have, I think this is Prof. Noran is doing a wonderful study for Malaysian as well. But I'm just looking at some of the publications being done, some of the things that looking at when it comes with the COVID-19, is there any effect of long COVID? So especially for the older adult, it's very important, because once you're having COVID, you are being hospitalized for quite some times. Once you're immobile and bed rest, and you will increase your inactivity. As a short term, you will see the reduction in muscle mass, reduction in your muscle strength, as well as you've always been fatigued and always have local and systemic inflammation. So you always feel pain everywhere. Thus, when you're looking into long term, I'm not discussing anything at all with the pharmaco treatment, but you can see, because the treatment is needed for you to actually get better from COVID-19, this also will have an impact towards your muscle mass as well. So as a long term, if you're older adults, if you don't actually beefing up your body, and as well as looking into your diet and physical activity properly, in the long run, you are accelerating your frailty, and you're also declining your functional capacity. So this would be require a lot more work for researchers to see, is there any possible intervention that we can do to make it better? So what are the evaluation of muscle mass and screening tool? So muscle mass, normally we will use to look into using the computed tomography or MRI, or sometimes when we don't have those things, we just need to use validated tools that is called the screening tool for sarcopenia, or SARC-F. Or sometimes for us who know or can use muscle strength as a simple measurement for hand grip strength, even though it's just focusing for the total body muscle strength on the upper abdominal, that is still good enough to give you some idea. So I don't have much information about muscle strength longitudinal study in Malaysia, but just sharing with you, even though from our work, we are looking from aging point of view in terms of those who are adolescents, what we notice, even though this group who are actually growing, if you don't give them enough in terms of the right micronutrients and protein and energy, you won't see much of increment of their muscle hand grip strength. So let alone, you can see the boys is actually becoming stronger, but the male increment of muscle mass is actually not that great. By right, they should. But what we notice as well when we look into the determinants of it, higher protein and carbohydrate intake among males was associated with higher muscle strength, but not in females. But bear in mind, from our cohort, we have seen the female are actually not very active as they grow older. So what else we can learn from the hand grip strength? It is apparently hand grip strength also is a risk factor for type 2 diabetes. And let's see from this systematic review. And what do they see? From this systematic review, they're looking at the assessment from small effects, looking at if they are having diabetes and how's their hand gauge strength. What they notice from the pool analysis, basically they are combining from all over the observational cohort studies. What they see is those who are having lower hand gauge strength have a tendency or greater risk of developing type 2 diabetes. So let alone if you're doing a cohort study, don't forget to look into the hand gauge strength of your participants. In addition to that, people normally will ask, but what would be the reference or the cutoff for hand gauge strength? We never know whether we are not that strong or we are strong enough. So lucky enough, I think we are living in the era where a lot of publications has been out there. It's just a matter of us to check. So this is a good study done by this group, Pure Studies, looking into the prospective urban-rural epidemiological study, country representative from Southeast Asia up until South America, and they try to see what will be in terms of the strengths for certain age group and between comparison between female and male. And what do they see is majority, if you're from the Europe, North America, you're a bit more stronger, but as you're going to Asian countries, we are a bit weaker. The reasons still need to be explored. However, it is very crucial when you are referring for the hand gauge strengths, you must refer it not to the Caucasians, but refer it to your local context. And here, just a recap, if you're looking for Southeast Asia for us, even though for female, if you can have 23, that is our average. So if you have your dominant hand is more than 23, you are a bit stronger. But as you grow older, you can see even though for men, from 40 to 37 and 33. And surprisingly, even though from our younger generation for female, some of it is actually already lower than the women who are within this age. So more work needs to be done in terms of health promotion and in terms of lifestyle changes. But I just put it here for those who are interested to do it, such studies for you guys to have a look at. But how about the nutrition in increasing muscle strength? So maybe I will give you the protein intake and exercise for optimal muscle function. And this is looking from this large group of Eastburn group and led by Nick Deuce, who actually the professor in terms of kinesiology, looking into this. And definitely protein status got to do with factors that leads to lower protein intake, because older adults, your medical conditions, physical disability I mentioned earlier on, don't forget socioeconomic conditions. You used to work before, now you can't, unless if you have a good pension. Physiological changes I mentioned earlier on, or maybe potentially for some genetic predisposition. But you know, as you're growing older, you really need your higher protein needs, because some of disease-related protein catabolisms require that. If you're sarcopenic, you require that as well, and decreased muscle perfusion, and some of it can be with your anabolic resistance. So how much is you needed? Based on this review and based on these manuscripts or suggestions by the experts, older adults requires greater protein. I'm talking about healthy older adults. I'm not talking here about, I will talk a little bit when it comes to when you look into your kidney health, but this is a general healthy older adults, because older adults may also have decreased intake due to age-related appetite loss and medical conditions. And the optimum they recommend is between 1 to 1.5 gram per kilogram body weight. And don't forget, you cannot just do your thing when you're just focusing on food, but you also have to focus with exercise. Despite some studies have shown food plays a role, because 80% of it related to food and 20% has got to do with exercise. A resistance training is something that has been put more and more now, even though with WHO recommendations, and a combination of resistance training and adequate dietary protein, very important for this aging group. And with the recent paper, I'm not sure whether you have seen, in fact, you are not actually metabolic rate going to be reduced very much. In fact, your metabolic rate up until 60 years old are still really good. So please put aside your lame excuse such as our metabolic rate is going down. In fact, more and more studies showing that we are still doing fine up until the age of 60. So I put it there. So healthy older adults, we need about 1 to 1.2 grams of protein. And if you're actually having some undernutrition, acute or chronic, your requirements slightly higher because you do have issues with some severe illnesses, or maybe you are doing some of the exercises. So when we talk about protein, some people are talking about, do we need certain types of amino acids? There are few papers working on it, but most of them have been worked in the critical illness. So they are looking at if you want to give a manipulation of leucine enriched, which is called EAA, or the beta hydroxy beta methyl butyrate, or we call it as a HMB. So what is HMB? It's a bioactive metabolite formed from decomposition of leucine and essential branched-chain amino acids, and these are required especially as part of the muscle protein anabolism. Just to make it life simple for all the audience, there's a study been done already with a randomized control trial looking into the intervention. Either you give them just a normal oral nutrition supplement with any type of protein, and an intervention group with another what we call it extra of this, not extra, so with the supplements as HMB. So what do they see is actually when they assess it at the end, from these 107 randomized patients in the intervention group and the control group, what do they notice? The concentrations of protein and vitamin D had increased more from those who are in the intervention group. So it is good. So if you're interested, please have a look at this paper. So diet enriched with HMB improves muscle mass and prevents the onset of sarcopenia. So if you are seeing some patients, or you know that you are seeing some of the older adults and elderly, this may be applicable for your group. And in Malaysia now, I think the same with Malaysia, Indonesia, we do have some products now that is high, they promote it with high in HMB. But bear in mind, I don't have any working collaboration with that, but this is more for the for scientific purposes. Now, as I mentioned to you, we need more and more protein. Maybe some of us will start to think, oh, hang on, when you are looking at the protein intake, does it affect kidney? Yes, it will for those who are already having issues with kidney, if you're having diabetes and so on. But among healthy older adults with some of the studies, I'm using the one that is a systematic review, and they are looking into what we call the RCT as well. No conclusive evidence, either animal-based protein or plant-based protein, that are going to influence kidney health outcomes. So that's great, right? So the short-term higher protein intake, in fact, with your normal kidney function, look into your GFR among healthy adults might actually give you some benefits. And rather than just concern about how it will affect your kidney, because sometimes the older adults, they don't actually having problems with the kidney, but it's just like they don't eat that much. But the treated adults, or the diet quality has becoming less. There's some studies looking from longitudinally, if you increase your protein intake, there is an observation they are also minimized in terms of your frailty risk. Oh, hang on, that's really good. This is a study that has been done by the group of Carlo Jr. So what will be my take-home messages? Okay, so to make it short and sweet, nutritional factors is important, but it can't stand alone, as it still requires physical activity, and especially when you are also older adults during this time of COVID-19, a variety of food with high in antioxidants, or make it preparation at home, is very important. Definitely in terms of the diet quality is crucial for us to look into. And in order to achieve that, for you to move on, or to move forward, or to becoming more stronger, definitely not just the nutrition itself, you need experts from either the physicians, either from the physiotherapists, to give more input if you are already in a sick situation. Please also use your muscle. This will be another take-home message, because after all the works you have learned, maybe nowadays you can see more and more people are using online exercise, which is brilliant. Before this, we don't see that much, but people are now doing it. So it's coming back, looking at how you look at challenges as opportunity. That is very important. And then personalized and targeted approach. Despite my talk saying that you need more protein, you need certain things, you need more of this and that, it needs to be personalized, because if you are older adults with certain conditions, with certain diseases, definitely your requirements needs to be tailored according to your disease specific. And especially if you have kidney problems already with hypertension, your requirements may be slightly lesser, and you need to discuss with your a team of nephrologists and also your dietitians there or nutritionists there on how much you can. So progressive and some resistant exercise is always good. So I would like to say for the reflection for future intervention, when we are in the older life or lancia, we always look into the reflection when we are having our early life, because if we are not doing well from here, when we are reach this area, we should be also trying our best to minimize the loss or the problems. But if you are the one who are now the adults having your kids that to look after, or you are actually the one who are also pregnant and everything, there is a room, a huge room of opportunity for you to make some changes, as these changes will also delay of your trajectory of the development of non-communicable diseases. So I know we are getting better now. I think everybody is going out, but increasing physical activity, whether you can do it, continue doing it either at home or at office, try to increase it. Unless if you have some pain at a knee joint pain, then you have to do some other exercise. Maybe some other less weight bearing exercise will be better for you. And as a researcher, as a people who are coming to this particular talk, what should we continue doing? So to ensure the populations continue to access and consume healthy diets, what we can convey messages to the governments, we also want to ensure that the food system and health system are intrinsically linked. Because I think with COVID-19, we learned a lot how this food system and healthcare system, sometimes it is not linked properly. And based on our experience with these 18 months, we should pick it up and try to give suggestions on how to make it better. Because I remember in Malaysia, there's a lot of fruits and vegetables that are actually been thrown away at the top of Genting, Cameron Highlands because it cannot reach Kuala Lumpur. Okay, things like that. Ensure healthy and affordable food is available for all. And this is actually going to be a challenge because as the economy is going to recover, certain healthy foods or even if certain foods has increased in terms of their price. In Malaysia itself, you won't get much of a chicken less than 40 ringgit for two. If you buy at the market now, it will be more. Okay. Continue advancing obesity and NCD prevention policies that are in development. And also you have to work collaboratively with your food industry and also to run the campaigns in terms of the food preparation in order to offer healthy and affordable food. And at the same time, as parents and as academicians and also as the students, you always have to be on alert, looking either from the policies or on the actions that you can take to ensure that we can get access to healthy diets and also ensure the policies are relating to healthy diets are still there. Because during these COVID-19 times, people tend to overlook because during the COVID-19, it's just enough for people to get enough food, but whatever the food's going in, it doesn't really matter. It is very crucial, even though from our work that I shared from our webinar before, we definitely see you need to modify because some of the foods that they give as a to help this needy is very, very unhealthy. Okay, and that's about for me. Thank you very much. And I should stop sharing. I hope I'm on time, 40 minutes. There you go.
Okay, well, thank you so much, Professor Hazrin. It was really insightful. Your presentation has increased our knowledge regarding what is actually the nutrition necessary and best recovery for the elderly in this COVID-19 pandemic. Well, once again, thank you so much, Professor.
You're welcome.
Okay, well, ladies and gentlemen, now we're headed to go to our next session, which is the question and answer or discussion session. So yeah, for those who have question, you can either drop your question in the chat box or you can directly deliver it by an open mic. Okay, once again, dear honorable participants, for those who have question, you can either drop your question in the chat box or you can either directly deliver it by an open mic. Thank you.
Just to tell you, because I need to dash off after this, I won't be able to join. If you have any 1 or 2 questions, then that'd be great. If not, it's fine.
Okay, Professor. Maybe we're going to wait a little bit longer for the participant type their question. Okay, well, Professor, I think there is no question. Your presentation is actually very clear enough, so everybody can understand your presentation.
Okay, thank you very much.
Okay.
And okay.
Helmi aja yang tanya, Helmi. Maybe you have a question, Helmi, for Prof. Hasrin. Ini mohon maaf nih Prof. Hasrin, saya paralel ya, jadi nggak ada pertemuan-pertemuan. Iya, jadi mohon maaf nih paralel.
It's okay, it's okay. We understand. We always do that as well.
Iya.
If there's no question, it's fine. Then we can proceed with Prof. Noran. And I'm sure if you don't ask me now, I'm still going to deliver something during the FPAC conference next week. So if you still have questions, you can actually ask me questions later as well. So no rush. You can put in my chat in the chat box, and I'm more than happy to answer when I see you again. Okay. If there's no question, please forgive me. This time I couldn't be joining the overall. And thank you so much to Unair. And thanks, Prof. Noran, for also joining us this time. Okay. Thanks, everyone.
Yeah, okay, well, thank you so much for joining all of us here, Professor. It was really insightful.
Thank you, Prof. Hasrin. Thank you so much. Yeah.
Okay, well, ladies and gentlemen, since we have a really brief time for the sessions, now we're going to go to our next main session that we've been really looking forward to, which is the presentations of our second topic, which is maintaining the health of elderly during this COVID-19 pandemic, that will be delivered by Professor Noran. Okay, but before that, let me read the curriculum vitae of our second speaker today. To the committee, you can do your own screen sharing, man. Okay. Okay, for the administrative duty, now Professor Noran became the research cluster dean in University of Malaya from January 2021 until now. And for the academic qualification, Professor Noran has finished her Doctor of Philosophy in University of Sydney, Australia in 2011. And for the membership, now she is the member of Royal College of Physicians, United Kingdom, as the executive committee member since 2014. Okay, probably that's all from the brief reading for Professor Noran's curriculum vitae. So yeah, without any further ado, to Professor Noran, time is fully yours.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Madam Moderator. And a huge thank you to Ibu Santi, Ibu Lucia dan Pak Trias on the invitation to deliver this webinar. I'm very grateful and thank you for the opportunity to share the experience that we have on COVID-19 pandemic, especially looking at the maintaining the health of older people. And I think some lessons we can learn from Malaysia. Unfortunately, Malaysia is not doing very well. I see that Indonesia is doing better. So maybe an opportunity from us to listen to what the achievement or the success of Indonesia will also be great if we can organize another future sessions or webinar on this issue as well. The second thing that I would also like to pick up from Ibu Santi's welcoming address just now was on the component of doing more research together. I think that's a really interesting suggestion, and maybe if there are avenue we can discuss further on that, because just to let you know, between myself and Prof. Hasrin, both of us have done cohorts. We have cohorts of studies. So Prof. Hasrin does cohorts of adolescent studies and I do cohorts of older people. And from the cohorts, we have actually gathered a lot of information and findings. And I think this is we can one of these times just sit and discuss further on that. So back to the topic of interest for today. So today's topic is actually on maintaining the health of older people during the COVID-19 pandemic, especially in the Malaysian scenario, right? So I'll be talking about these 4 issues. Just to give some context or background, what is the health of Malaysian older adults? And then how has COVID-19 actually impact on Malaysian older adults, especially in terms of the physical health as well as the mental health? And one issue in particular that I might go a little bit deeper is on the issue of elder abuse and neglect. And then finally, because this month or the month of October, the 1st of October is always the International Day of Older People. And the theme for this month, or the theme for this year actually in 2021 is digital equity for all ages. And maybe just a little bit of a glimpse, what does it mean on digital equity for all ages? And I think for countries like ours, uh, it's quite difficult in terms of the digital equity where we don't have all our older people, especially having the knowledge and the equipment to be on digital technology. So just as an introduction, so this is Malaysia, right? So um, people are living longer. Itu kita tahu. It's the rest of the world. Everyone is living longer, and Malaysians juga sama. So on the average, our life expectancy is similar to many other upper middle income countries. And if you look at the proportion, the 60 years and above, so we define age 60 years and above as older people based on the definition made at the World Assembly on Aging 1982 in Vienna. And in 1990, we see that the proportion or the percentage of older people aged 60 years and above is about 5%. It's moving on. In 2017, when we call ourselves the aging population, we have about 8%, and this translates to almost about 2 million population of older adults. In 2030, that's 10 years or less than 10 years from now, we are going to be an aged society. So 14% of our older people in Malaysia will be roughly about 5 million population. And not further from that, in 2015, we're going to be a hyper-aged society. We're almost 24%. That translates to about 10% or out of the 40 million population. So kalau dilihat dari unjuran populasi, this is just a graph showing the trajectory of the older people aged 60 years and above in the country. So you can see the trajectory is actually going up. And something different between the older population in our part of the world compared to those in the West is that we don't have as the luxury of time. So in some countries, the number of people doubling to become older people, it takes about almost 100 years. But in countries like ours, in Malaysia, in Vietnam, in Thailand, in Indonesia, it takes only about 30 years. So you can see the difference. Jangka masa itu amat pendek berbanding dengan negara-negara yang lebih maju seperti di Perancis, di Australia. So you can see the vast difference between the Asian country as well as the developed country. So this also does bring about some challenges in terms of the issue of older people in our part of the world, right? So this is just looking at the age structure. So the age structure in Malaysia, or the population pyramid, is something like this. So you can see in 2015, it still looks like a pyramid, but moving on to the next, it doesn't look like a pyramid. I mean, it's less likely to be a pyramid. And one of the things that actually predominantly changes the age structure is the difference in terms of longevity. That means jangka hayat kita lebih panjang, dan fertility rate. Fertility rate semakin berkurangan. That's what's happening in Malaysia. And interesting, if you look at the different ethnicity, so we have three large population of ethnicity in the country. So we've got the Malay Bumiputra, or the Bumiputra, that includes the Malays plus as well as the Orang Asli and the local population in Sabah and Sarawak. So we call them the Bumiputra. We also have the Chinese as well as the Indian. Tapi kalau kita tengok dari segi perbezaan di antara tiga-tiga populasi ini, you can see that the difference in the population structure, especially among the Chinese, it's not the same. And you can see that the Malaysian Chinese are actually aging faster as compared to any other ethnic group. So
Suaranya di mute.
yeah. Okay, dah di unmute, boleh dengar balik?
Yes, ma'am. Yeah, we can hear you clearly.
Okay, thank you. Sorry. So basically, just this slide just shows that there are differences in the different ethnicity, and it shows that among the Chinese population, they are aging faster than any other ethnicity in Malaysian population context. So sebagai gambaran, the life expectancy in 2019, you can see male is about 73 years, whereas in female is about 78 years. And this is something that we see across the world. Di merata dunia, kita dapati ada perbezaan di antara lelaki dan perempuan in terms of life expectancy, and this is what we call as feminization of aging. And I think another slide that I showed that I've given is also to look at the difference in the life expectancy between the different ethnicity. And again, there you can see that the Malaysian Chinese are actually aging faster than any other ethnic group in the country. Wait, kenapa slide tidak mau bergerak? Sorry, slide issue. Okay. So one of the things that I always like to say whenever I give this topic on issues of older people is that we have to remember that the peningkatan jangka hayat ataupun jangka hidup dan penambahan warga emas di dalam sebuah negara is actually an achievement. It's a success. We know that there are challenges, but it's actually a success, a public health success of the country when we have aging population. And again, penuaan penduduk ni melambangkan kejayaan kesihatan di any country, not just in Malaysia, but in any parts of the world. And we also must acknowledge that the older people are not homogeneous. Dia tak sama semua, right? So they are not homogeneous, and there are diversity in terms of older age group. So there is kepelbagaian di kalangan warga emas, and this is something that we really have to acknowledge. There is no typical older person, right? In fact, I think in our last two prime minister, he's actually a 95-year-old person. So imagine a 95-year-old can still become a prime minister. So again, there is no typical older person. It is not homogeneous. Older people are actually very, very heterogeneous. And some 80 years old have physical and mental capacity similar to any 20 years old. So, but others might experience declines in the physical and mental capacity. So one thing to note is that population aging is a success. So it's not just challenges, but it is a success. That's something that we have to be proud of. And older people are not homogeneous. So there is no typical older person. There is always heterogeneity in terms of the older people. So let's have a look at how older people in Malaysia has been. Okay, so I'm not going to present all the findings. So this is a study done in 2018 by the Ministry of Health. So it's called the NHMS, or National Health Mobility Survey 2018. If anyone is interested, the site is there. You can see a lot of issues were looked at in this NHMS, but I'll present the issues that are relevant to the COVID-19 issue that I'll be talking about. So with regards to non-communicable disease ataupun penyakit tiga berangkai yang selalu kita katakan, diabetes, hypertension dan hypercholesterolemia, dalam kalangan warga emas di Malaysia, almost about 1 in 3 ataupun 30% ada diabetes. 1 in 2 ataupun 50% ada hypertension, dan almost about 40% ada hypercholesterolemia. Jadi isu non-communicable disease adalah satu isu yang agak besar di kalangan warga emas di Malaysia. And when we looked at issues of dementia, right? So dementia is also another issue. It's a chronic disease or chronic degenerative disease, and it leads to deterioration in terms of memory, ingatan, it impairs the thinking and comprehension. Serta dia ada juga berlaku changes in behavior ataupun perubahan dari segi behavior, and affects the ability of the person with dementia to actually perform activities of daily living. And I think dementia has already been said to be one of the public health importance with regards to issues of older people. So it's important to know what is the baseline of dementia in the country. And in Malaysia, we use what is called the IDEA ataupun Identification and Intervention for Dementia in Elderly Africans cognitive screen, and this is already a validated tool to screen dementia. and we've validated it in the country. And this is used to cognitively assess dementia. And what we found is that in Malaysia is about roughly about 8%. And there is a difference between dementia, issues of dementia among those in the rural area of as compared to the urban areas. So you can see this is just a graphic presentation. The one in the rural area is slightly higher, almost about 13%, at more than 1 in 10, and the ones in urban area is lower. And in terms of education level, ia juga lebih banyak di kalangan warga yang tidak mempunyai education level yang tinggi. And marital status lebih tinggi di kalangan mereka yang tinggal bersendirian ataupun tidak for some reason either divorce ataupun the spouse has passed away. So these are issues that we see in the country with regards to dementia. And the next one is on mental health ataupun depressive symptoms. So we use GDS, Geriatric Depression Scale. It's also validated. And we see that almost 1 in 10 of Malaysians, older adults, actually have issues of depressive symptoms. And again, gambarannya adalah berbeza di kalangan warga emas di rural area berbanding dengan di urban area. So we see a higher prevalence of older people in the rural area actually having depressive symptoms berbanding dengan di urban area. So again, slightly different between men and women. So feminization of aging, where we have older women living longer. We also have older women actually having issues of depressive symptom more than men. And then among the lower education level, similar to what we see in dementia. So this is what we see in 2018, issues of older people. And this is something like what Prof. Hazrin mentioned tadi. So basically in terms of functional capacity, this is very important because as human being, functions is an important thing, and by and large, most functions actually begin decline bukan masa warga emas, tetapi penurunan, you can see that the reduction actually happens even at the age of adult if we don't take the good things in consideration. That means in terms of nutrition, in terms of physical activity. So you can see the reduction already happens. And what we have in the adult stage is actually to reduce the disability threshold. Sebab ada akan satu masa di kalangan warga emas di mana sekiranya functional capacity itu terlalu rendah, then you cannot do your activities of daily living. So you have to be very dependent on other people, which is something that we don't want. So changes in biological abilities will occur at different types or different stages of life and at different degrees. But the speed of decline is also very, very important. So you want to reduce the speed. You don't want the trajectory to be so markedly reduced. Maknanya kalau dia terpaksa turun pun, dia akan turun dengan lebih mendata, bukan begitu mendadak. So that is the thing. And all this speed of decline is actually very largely determined by factors that's related to a lifestyle. So it's something that we can actually improve on. So things like smoking, alcohol consumption, nutrition, diet, and environment is something that we know that can also reduce in the quality or in what we call as our functional capacity. And in the National Health Mobility Survey, what we see is for basic healthcare ataupun activities of daily living, 1 in 6 are unable to do their basic activities of daily living. So what do you mean by basic activities of daily living? So benda-benda basic seperti makan sendiri, memakai baju sendiri, pergi ke tandas sendiri, buang air ataupun buang air besar, buang air kecil, personal hygiene, mandi ataupun sikat rambut. So all these very, very basic things that you would want to maintain as long as you live. So 1 in 6 among older people in Malaysia are unable to do that. And when we talk about IADL, it's actually even higher. That's about 1 in 2, 50% have inability to do IADL. So IADL has a bit more cognitive punya keperluan. So things like maybe using the telephone, so dialing, so you need to remember the numbers. Budgeting, melihat kepada budget at the end of the month, misal kata, ataupun penggunaan wang. So you need a bit more of cognitive ability. So we see that it's quite high, 50%. So kalau ada 2 orang tu seorang memang ada kekurangan di segi IADL di kalangan warga emas di Malaysia. Right, so and some of these are actually newer findings lah, so findings as in 2018. And then another thing that's also important with regards to COVID-19 adalah social support. Apabila kita lihat kepada social support, we see that it's quite poor in terms of social support. 1 in 3 or almost about 30% have poor social support in the country. And tak banyak beza di antara rural dan urban, so about 33% versus 30%. And this is something that is also, when it comes to pandemic like COVID-19, it does gives quite a bit of difficulty among the older people. And if we look at living arrangement juga, dia agak berbeza. You can see from 2004 to 2014, there's a lot of difference in terms of the living arrangement when it comes to those who are staying alone. So you can see about almost 10% or 1 in 10 actually are staying on their own. So this actually brings about a lot of difficulties, especially when it comes to issues like BID ataupun brought-in date. We have a lot of issues of brought-in date with regards to COVID. Maknanya tak ada siapa tahu pun dia dah meninggal kat rumah sebab dia tinggal seorang. Hanya dia saja yang ada di rumah. Tiba-tiba neighbor ataupun jiran mengatakan bahawa ada bau yang keluar dari rumah tu dan paksa telefon polis. We got a lot of stories like this happening in the last in past 2-3 months, where our surge of COVID-19, especially dekat Klang Valley, the greater Klang Valley, was very, very high. And so these are some of the reasons why, because especially when you have poor social support, you don't have social network, you're staying alone, these issues arise. So let's just go and have a look at what is the COVID-19 situation in Malaysia. So if you look at the graph, so the graph is actually telling us since the COVID-19 pandemic started in early of last year, so in basically somewhere in January and March last year, right up until August this year, right? So the first case in Malaysia was actually detected on the 24th of January. And this was the first case that we had, was actually a traveler, a person from China who came to Malaysia from Singapore. So this was the first case, and during the initial stages, masa ini, the approach was more relaxed. There was no lockdown or anything, and it was just centered trying to contain the epidemic without alarming the population. So tak ada restriction, population masih boleh bergerak masa tu, and public health response adalah seperti dengue outbreak, sama macam any other outbreak lah. That was in January 2020. And then what happened was there was a sharp increase in March, right? And this is actually from members of a religious gathering, or we call it a Sri Tabligh cluster masa tu. And this large cluster was what we call as our second wave lah. And because of this, the government decided that they are going to take over the management of COVID-19 pandemic. So it was no longer under Kementerian Kesihatan or Ministry of Health. And from this cluster actually was detected from Brunei. And Brunei was the one who alerted Malaysian government that there is this cluster going on. And then we took over, right? So this actually prompted the government to consider this as a national security problem, and the overall management of the pandemic was then taken over by the National Security Council. Because sebelum ni hanya Kementerian Kesihatan sahaja yang mengendalikan outbreak management. And because we had this sudden increase in numbers, and the gathering was rather large, and the people then moved back to their own hometown. So we had to have a lockdown approach. So this was the first lockdown. We had our first lockdown in March, 18th of March 2020, and we used 2 laws. I think later I will talk about the primary, secondary, and tertiary prevention in terms of COVID-19 pandemic. And if you look at the primary prevention, one of it is actually regulations and laws. So we had to use 2 laws in order for us to execute this movement control order. We call it as MCO ataupun movement control order. Sama lah maknanya dengan lockdown. Cuma kami bagikan nama lain lah, ataupun PKP, right? PKP in bahasa. So the movement control order or MCO 1.0 was started in March 2020 and it's based on two acts. So Act 342, that's Prevention and Control Infectious of Disease Act 1988 and amended 2006. So that's under the Ministry of Health, and the 344 Police Act 1967. So these were the two acts that we used in order for us to do the first MCO 1.0. So then after MCO 1.0, we see that the numbers have declined. Then we moved to, rather than the strict movement control order, we went into the conditional movement control order where a little bit more of the other industries can open. And then eventually we move into the RMCO, we call it the RMCO control order lah. Maknanya masa tu banyak lagi pembukaan telah dibuat, sektor-sektor industri semua dah dibuka. And we see a reduction. In fact, in July 2020 last year, we even had a 0 case COVID. So we were quite proud that time, tak ada case COVID lah. Maknanya we managed to control the COVID cases very well. Unfortunately, somewhere in September, October last year, 2020, we had to have a Sabah state election. So when Sabah state election took place, there were a lot of campaigning. So seperti biasa, masa election, there will be a lot of campaign. So people from the peninsula went to Sabah and actually campaign, came back. And those who went back to Sabah to vote and then came back. So there were a lot of non-adherence to SOP. Walaupun SOP telah diletakkan, tetapi apabila ada crowd gathering dan semasa campaign tu banyak yang bercakap dengan begitu what do you call it, begitu berapi-api sekali. So you can see a lot of the virus was actually moving around, and that caused the third wave, and we never recovered from the third wave. So that was somewhere in September 2020. And when people came back, so the infections from Sabah was already infected then, it went to Selangor, it went to the rest of the Peninsular Malaysia, and then the numbers kept on going up. And after that, we had another MCO, so a strict movement control order. This is somewhere in January, early of this year. And then we relaxed a bit when the numbers dipped down. But I think, unfortunately for all of us, Delta came. Right, so everyone was affected with Delta. All countries were affected with Delta, and even Malaysia was affected with Delta, and the numbers surged back up again, and we went into another round of lockdown as well. So that was basically, in a nutshell, what has happened in these last few months. And I think if you look at the worldwide, so approximately about 250 million people have been affected by COVID-19 with 5 million deaths, and approximately in Malaysia about 2.5 million with almost about 228,000, I would say, about 28,000 deaths in the country. And I think for a small country like us, that's actually quite disheartening to see. So we're not doing very well in terms of managing the COVID-19 pandemic, right? So this is just to illustrate. This is our first case, was the apa yang dikatakan traveller, right? Our imported case. So 24th of January 2020. Masa tu case tak banyak, and it's just among the imported case, the tourists. And then we had our second wave, the Sri Petaling cluster, the Tabligh cluster, that was alerted by Brunei actually to the Malaysian government. And because it was a gathering of religious people, quite a number of people from other states were here in Sri Petaling, and they moved back to their own states, and that was quite a scare. So, but we managed to control that, we managed to contain that. I think one of the reasons is that was the first Wuhan virus, the first variant, not the different variant. And then we had our Sabah election. So the Sabah election actually really made the third wave that we never recovered. And so post-election, when people came back from Sabah after campaigning, after voting, Peninsula got affected. And in fact, in Sabah, the variant was already different, but it wasn't given any name, but it wasn't the Wuhan variant anymore. And in fact, from that, what we see is, of course, the Delta variant came about. So, but now, so graph tadi tu tak sampai ke waktu kini. So if you can see now, currently in the last 2 months, we have been showing quite a drastic decline, Alhamdulillah. And even beginning of October, banyak pembukaan telah dilakukan, so we can now cross states. So sebelum ni memang kita tidak dibenarkan untuk pergi ke negeri-negeri yang berlainan. Maknanya if you're in Selangor, then you're stuck in Selangor, you can't move. But now the relaxation has been given. But of course, recently, even yesterday, there were already numbers showing that the number of cases in the hospital is already increasing in terms of trend. So that is also pretty worrying. Of course, when we have numbers decline, then the questions that we ask is why should we open? That's easy. Human social animals, so we need to see people. We cannot be in lockdown forever, so we have to try. And one of the strongest reason why we are able to open up is because our vaccination rates have been high. So our vaccination actually started somewhere in February, and we've been doing quite a good job in terms of vaccinating. And how do we open this safely? Again, the SOPs have to be very strict, but of course there will be issues lah. And how are we doing so far? Alhamdulillah, so far we are on the decreasing trend in terms of number of cases, but I'll also show you we're not doing very well in terms of death. We are still seeing quite a large number of death. So apabila kita lihat kepada active case, so on the average daily basis, we are still seeing 4 figure. Maknanya kes kami di Malaysia ini masih dalam golongan 5,000, 6,000, 7,000. We have seen a reduction from 10,000, which is good, but it's still within that range. And one of the important things that we also need to note is the fact that our active cases is actually quite high, right? So we have quite a big of active cases. Sorry. So our active cases is almost 5 figure, right? So it's gone down to 83,000, but it's still quite a substantial number lah. Maknanya walaupun kita buka, active cases masih banyak, so that is something that we really have to worry. But because of the vaccination, what we see is the trend is different, where the home quarantine is high. Now we can do home quarantine for an isolation for those yang dah ada positive cases. Those yang masuk ke PKRC ataupun apa yang kita katakan sebagai pusat kuarantin dan rawatan COVID juga agak tinggi. Tapi kalau dilihat kepada kategori ataupun stage 3, 4 and 5, so it's not so high. So you can see those who are needing ventilation is less than 1%. Those needing oxygen is also less than 1%. So because of vaccination, this has helped to reduce in terms of the severity of COVID-19, because that is something that we know for vaccination. That's what vaccination has been doing to our population, which is good. So this is what I mentioned about death. So in terms of death, we are on the declining trend, but for a nation of, there's only about 30 million population in Malaysia. So we are not, you're not a big country, we're a small country. But with a small country, we're already looking at almost 30,000 deaths with regards to COVID. And the numbers are declining, yes, but we are also seeing issues of brought-in death. Maknanya kematian yang tidak disangka ataupun tidak diketahui sama ada mereka itu COVID atau tidak, dan dibawa ke hospital baru kiranya kematian berlaku di rumah lah, bukan di hospital. So brought-in death is actually quite a substantial number, and daily we are still seeing 100 cases of death per day. So that is something that we really need to work on. Looking at age group, of course, vulnerable age group adalah those age yang lebih 60 years and above. So you can see quite a number of older people are actually in the death number. So they contribute almost about 70%. And just like any other demographic profile of other countries juga, by gender, male actually contributes a higher proportion of mortality with regards to COVID. Now for vaccination, we're doing well. Our population vaccination is actually rather high. So fully vaccinated, this is total population fully vaccinated is about 70%. Kalau adult population vaccinated is even higher. And now what we're doing is actually we're moving to vaccinating the remaja lah. So now is actually the time for vaccinating teenagers. So those age above 12 years old are given vaccination, COVID vaccination right now. And when it comes to COVID vaccination juga, because we see waning of immunity, maknanya those who have been vaccinated more than 6 months, the immunity is already going down. So concurrently, sekali dengan the teenage vaccination atau vaksinasi remaja, we also giving vaccination to one, the frontliners, two, to those who are the older people, that means age 60 years and above, and those who are already having non-communicable disease. So you can see that our NCD are actually a big issue in the country. So these three groups are already being given concurrently, are given the booster dose. So they're giving, so we're calling these three groups for booster dose. In fact, semalam, there is also issue about heterologous vaccination. Maknanya di Malaysia ni ada tiga jenis, predominantly lah, ada tiga jenis vaccination yang diberikan, Sinovac satu, AstraZeneca dan Pfizer. Jadi ada populasi yang diberikan Sinovac, and we see that the Sinovac waning of immunity is actually quite larger as compared to other dose. So it was already announced yesterday, siapa yang mendapat Sinovac dalam jangka masa tempoh 3 bulan boleh mendapat Pfizer. So we are already opening up heterologous vaccination. This is called heterologous lah, maknanya kombinasi vaksinasi yang berbeza. Dan bagi frontliners dan frontliners especially mendapat Pfizer. So for now, we are calling back all the frontliners to be given Pfizer vaccine again as booster dose, because the last vaccine that they got was somewhere in April. So that is already more than 6 months. So I think Alhamdulillah for now we have enough vaccine. Initially in the beginning, masa awal-awal tu, masa bulan March, bulan Jun, we were stuck because in the sense that the population wanted the vaccine tapi vaksin tak sampai-sampai. So we had quite a difficult thing trying to get vaccine. There were not enough vaccines, and there were also issues where AstraZeneca was quite, people were afraid of AstraZeneca because of the blood clot issue. So again, AstraZeneca was given in a different mode. Dia bukan diberikan kepada semua, tapi diberikan secara siapa yang mahu. Jadi there was one time when we had AstraZeneca, so the apps actually open up to anyone who wants AstraZeneca, and they key in to say that they would receive AstraZeneca. So so those are some of the issues that happened somewhere in the beginning of this year. So just a bit about COVID-19. So we know that in 2020, dua kumpulan yang berisiko tinggi adalah warga emas dan mereka yang mempunyai non-communicable disease, especially diabetes and obesity. And the prevalence of diabetes and obesity di kalangan warga emas adalah tinggi di Malaysia. Prevalence of diabetes and obesity di kalangan adult, bukan sahaja warga emas tapi adult juga adalah tinggi. So we are actually having this is one of the big issue, and this could be the cause of severe COVID that we're seeing in our population, especially when it comes to mortality. Now in 2021, because of the Delta variant, we see our total positive rate is very high. Our R0 always is exceeding 1. And here we see that semua kumpulan umur adalah berisiko untuk dijangkiti COVID-19. This is not just among those with high risk, maknanya those yang warga emas atau those yang mempunyai NCD, tapi semua kumpulan adalah berisiko. And because of that, we managed to get our vaccine in fast, and large population are being vaccinated. So Alhamdulillah, we can see the trend changing towards a lesser stages of COVID-19. So, okay, so this is just a paper to show our profile of COVID-19 cases in the country, and it's similar to what we see in other parts of the world. It's predominantly among the older people, those with NCDs, as well as those with the males now were more predominantly affected. And this again, just to illustrate what Prof. Hazrin has mentioned just now, our overweight population in comparing with other Southeast Asia region is not good. You can see the one yang paling besar sekali itu kita lah di Malaysia, 44%. And I think this is something that we need to learn from you, from our Indonesian counterparts, because your your figure seems to be much better than ours. So in terms of adults having obesity and overweight is a problem in the country, and this is something that might be the reason why our COVID-19 cases is actually quite severe, in the sense that our mortality for a small country of 30 million population sahaja, we already have almost 30,000 deaths because of COVID-19, right? So this just to map out how our overweight and obesity has been in the last, since 1996, 2006, 2011. So you can see that the graph for all age group, all the bars, nampak perbezaan yang warna kuning dari 1996 hingga ke warna merah, dia semakin meningkat, dia tak ada yang menurun. Kalau tengok setiap age group pun semua sama. In fact, if you look at the older age group, lagi menakutkan. Look at the one yang lebih daripada 80 tahun, for male and female, you can see the rise is really dramatically high, begitu meningkat sekali. So I think this is something that we are not doing very well. And the NHMS actually also saw that almost about 2 in 10 warga emas di Malaysia adalah mempunyai masalah obesity. So the malnutrition is actually among the in view of obesity or overweight, and this could be one of the reason why our COVID-19 management is quite challenging, in the sense of mortality is high. So another issue that I would also like to bring about is this thing called sembuh sembuh tetapi masih bergejala. Itu yang apa yang dipanggil sebagai long COVID. Maknanya seseorang itu dah sembuh, dah tak ada lagi COVID, dah tak boleh merebakkan penyakit COVID, tetapi dia masih mengalami gejala-gejala COVID. And this is something that we are seeing in a lot of COVID survivors, and it's not just in Malaysia, but it's also in every part of the world. And the symptoms or the gejala yang dapat dilihat ataupun yang diberitahu oleh pengalaman oleh survivors adalah begitu, it's so wide, right? And I think maybe just to reflect back, how is COVID-19, dia ada dua fasa. So COVID-19 has the viral phase, the pulmonary phase, and the host inflammatory phase. So apabila fasa itu berubah daripada the viral or response phase kepada inflammatory phase, dan sekiranya inflammatory phase ini, fasa inflammation ini berlanjutan, this is what we call as long COVID. Maknanya is the inflammation that actually causes the long COVID to happen. And we recently did a study on long COVID just to see what is the pattern of long COVID in the country. And again, you can see from the top, dari atas, dari rashes, chest pain, palpitation, difficulty in breathing, brain fog, inability to concentrate, feeling depressed, anxious, headache, tiredness, insomnia, tak boleh nak tidur, tak boleh nak rasa, loss of taste, loss of smell, diarrhea, loss of pain, joint pain. So variety of symptoms actually happen among the survivors of COVID. Dan simptom-simptom ini kadang-kadang berlanjutan sehingga lebih daripada 6 minggu ataupun 3 bulan. And I think recently WHO has come up with the definition that long COVID is because the definition is still very vague. Dia masih dalam kajian. I think what happens with COVID is that in this last 2 years, we've been very good in terms of defining how to contain the spread of COVID, because we needed to know how to stop COVID, right? So case definition for COVID-19, we're very good at that. Apa itu contact rapat, apa itu contact casual, we're very good at that. Close contact. What is the period of infectiousness? Maknanya bila viral load itu tinggi atau infectivity, we're very good at that. But when it comes to recovery of COVID, we're not very good. So we initially we think that if you have the illness and then when you're not infectious anymore and you recover, that's it. Unfortunately, this is not true. So there are issues of survivors with COVID yang mengalami apa yang dikatakan gejala long COVID ataupun berlanjutan, sembuh tetapi masih bergejala. And initially, people define it into 3 stages. Maknanya you've got acute COVID, COVID yang berlanjutan sehingga 4 minggu. Then you've got ongoing symptoms, maknanya 4 minggu hingga ke 12 minggu, and then you've got post-COVID yang melebihi 12 minggu. But recently, I think last 2 weeks, WHO keluarkan definisi yang terbaru, maknanya COVID, gejala yang berlaku selepas 3 bulan, yang berlanjutan selama 2 bulan. So the definition is still evolving, issues on long COVID. Tapi satu yang I would like to share from our findings, the Malaysian findings on long COVID is two things. One, who gets long COVID is among those the elderly and among those who have obesity. Again, our problem of obesity menghantui kita lah, masyarakat Malaysia. So long COVID predominantly happens among those who are older and those who have issues of overweight and obesity. And the reason could be those who have overweight are actually having inflammation or chronic inflammation happening in the body, a low form of chronic inflammation that's going on. Because you remember just now the slide that I showed, dia ada dua fasa viral, infectious, pulmonary phase, as well as the inflammatory phase. Jadi inflammatory phase tu berlanjutan, dia tak berhenti. Mungkin ini merupakan pathophysiology of long COVID. And another fact that I would also like to share is that when it comes to long COVID, dia tidak bermakna seseorang itu yang mengalami stage 4, stage 5 sahaja yang akan menghadapi long COVID. Malangnya, apa yang kami dapati adalah mereka yang mengalami stage 2 ataupun stage 3 pun boleh mengalami long COVID. So the severity of COVID does not dictate whether you have long COVID. So this is something again that is worrying because long COVID affects your health, long COVID affects your social work, long COVID affects a lot of things. So the component of long COVID tu agak menakutkan jugalah. And we had a webinar recently on long COVID, and what we realized is that when the participants share their difficulties, it's very saddening. There was one participant yang tidak ingat, dia ada brain fog, dia ada dementia, dia macam dementia. Dan apa yang berlaku adalah dia tak boleh nak drive pergi ke office. Sampai macam tu sekali, dia drive kemudian dia tak ingat ke mana, bagaimana dia nak pergi ke office. Dan apabila dia dah recover, dia boleh ingat, dia sampai ke office, dia tak tahu macam mana nak menjalankan tugas dia. She's an accountant, so she can't remember. She used to lead the team, so she can't remember what she told the team to do and how to do it. So the team was giving her support and trying to help her out, and it took her a while to actually have back, for her to remember back, for all the memories to come back. So again, it causes a lot of stress, it causes a lot of anxiety, and it really causes a reduction in your quality of life. So this is again something long COVID that we need to look into, and I think there are a lot of research still going on with regards to long COVID. Then another thing that I also like to share is that long COVID berlaku kepada semua. It's not just among the older people, the younger people, even for those the young kids who actually have COVID can also have long COVID. So this is something that is going to be quite a bit of an issue with the people who survive COVID in the country. So moving on to some public health intervention, sama seperti negara-negara lain, we use this list as public health intervention. So find, test, trace, track, trace, and isolate. Isolation bagi close contact, isolation bagi positive, quarantine bagi mereka yang close contact, and then early detection, prompt treatment, health promotion is something that we really need to look into, and non-pharmacological treatment, intervention, as well as MCO. So Malaysia has been using this, but of course the interventions are always strongest when they are combined together. And just to put into perspective of our public health or epidemiological prevention or intervention, when you look at health promotion, primary prevention, there's two: the health promotion and specific protection. So in terms of health promotion, again, health education, health, good nutrition, the healthful living, and of course legislation is very, very important. So this is the two legislation that I mentioned just now, what Malaysia use and what we have. So in terms of specific protection, again, isolation, quarantine, our vaccination comes here, and things like sanitations and stuff. So just to give you a glimpse of what we have in the country, I think all countries have this. So ini bahan-bahan yang kita edarkan kepada warga emas lah untuk for health promotion activity. In fact, there were dah masuk tahun ni ada 2 kali raya atau 4 kali raya yang kami tidak dapat beraya. Jadi raya is one of the biggest celebration in the country, just like in Indonesia, and when we cannot move, we cannot visit our older parents, so it's very challenging and very disheartening, but we had to come up with flyers to to tell people why it's better for you to have your own raya at home with your own bubble or your own immediate family rather than to go back and balik kampung and spread the disease. So unfortunately, masa raya itulah masa our numbers, cases are going up really high. So we had to do that. So this is just gambaran bagaimana our quarantine and isolation facilities look like. So this is MAEPS. MAEPS adalah pusat kuarantin dan rawatan COVID-19, and it's actually a exhibition center. It started off as a Malaysian Agro Exhibition Center in Sedang, and it's a huge big center, but we converted the center into a quarantine and isolation. We don't have the facilities like in China where they can come up with hospital within 10 days. So what we did was we were a bit more innovative. We identify big centers that we can use for isolation and quarantine centers. So we have been using this. And when the numbers were really peak, we had to also have what we call as the CAC. So CAC is COVID-19 Assessment Center. Maknanya sesiapa yang telah dijangkiti ataupun disahkan COVID-19 positif pergi kepada CAC ini dan akan diassess di CAC sama ada mereka ini boleh mendapat home quarantine atau perlu dimasukkan kepada quarantine center seperti yang saya tunjukkan gambar tu tadi. Jadi CAC was very important in managing the COVID-19 positive cases. And there was a time, I think last 2 months, where the numbers were really high, so we couldn't cope with physical CAC. Malah kita terpaksa bergantung kepada virtual CAC. So we had to move to a virtual CAC and digital home surveillance. So this is where technology really comes in to help with the management of COVID-19. And the CAC became a physical CAC, virtual CAC. We also have a mobile CAC and a hybrid CAC. So again, when things were pushed to a certain extent, we had to also come up with different kind of management or intervention to overcome, because the virus is smart. So this COVID-19 is a smart virus, so we have to be a bit more smarter than the virus. So pada warga emas, one of the things that we really had a problem was with the nursing home atau long-term care. So what happened is that we came up with documents, we came up with guidelines on how the home care people or the pusat rawatan atau the nursing care should actually take care of their warga emas. So with regards to the RSK atau rumah nursing homes, the government nursing homes, they are okay. But the private nursing homes are an issue. So some of the private nursing homes actually quite had a bad COVID-19 outbreak. But fortunately, we are not like countries like in the West, where a lot of death actually happens in the nursing home. So we are fortunate in that sense. Tindakan diambil awal dan sesiapa yang dijangkiti masih dapat dikeluarkan dan dimasukkan ke hospital atau dimasukkan ke PKRC, right? So again, vaccination, this is something that we started somewhere in February, and these are the phases that we did. So the first phase yang dapat adalah the frontliners, the police, the medical professions, and the army personnel. And then phase 2 would be the elderly and those with NCD, non-communicable disease. And then phase 3 was other adults was given. And then phase 5 is the adolescent. So phase 3 and 4 are among the workers, and phase 5 is adolescent. And sekarang ni in between, sandwich between phase 5 is the booster dose. So booster dose are coming in right now. And the AZ came in somewhere in phase 2 sebab ada isu berkenaan dengan AstraZeneca di UK, di mana banyak cases of blood clot berlaku. Jadi warga Malaysia agak khawatir atau agak gusar waktu tu. Jadi apa governmentnya approach was to open it up. Maknanya sesiapa yang inginkan terus log in kepada MySejahtera, our apps. So AZ was given in that sense. So kebanyakan frontliners mendapat Pfizer dan Sinovac bagi mereka yang tidak boleh mengambil Pfizer because of allergic reaction. And then we've got adults given AstraZeneca. And then we also have Sinopharm for those yang berada di luar, maknanya they just needed a single dose. So we also have single dose. So I think one of the things that's quite unique in our country is that we have multiple types of vaccination given. So we've got the mRNA, we've got the live attenuated, we also have the adenovirus method, right, for COVID-19 vaccination. This is just to give you an example of the laws that we use. So the Prevention and Control of Infectious Disease Act 1988 is a very strong act, and this act is still being used right now. Police Act was used because of the MCO. So the second part is, of course, secondary prevention, where early diagnosis and prompt treatment is very, very important here. And I think when it comes to early detection and prompt treatment, of course, the issue of disability limitation also comes in lah. Jadi apa yang ada, hospital-hospital semua telah bersedia. We have hospital designated purely for COVID-19 management. And then when we had a sudden surge, especially in Klang Valley, we had to open up hybrid hospitals, and in fact we had to convert some of the hospitals into COVID-19 hospitals, so they had to stop getting or treating other forms of condition, but instead focus on COVID-19 sahaja. And then we also had to have what we call a makeshift hospital. Maknanya this is where the army comes in. So we had a strong collaboration with the army, and the army actually came and helped coming up with armed forces makeshift hospital. So if you can see the picture kat situ, gambar tu hospital-hospital di dalam kemah. Jadi hospital-hospital di dalam kemah ini diletakkan ataupun diadakan dalam jangka masa terdekat bersebelahan dengan hospital-hospital yang ada. So this was done in a very fast manner, and I think the very strong relationship between Ministry of Health and Ministry of Armed Forces was very good in this sense lah. So just these are some of the pictures of our hospitals that we had, and of course we also needed to up our lab facilities because COVID-19, seperti yang semua orang tahu, we needed the lab to be very, very fast in terms of coming up with the results, right? Kalau results tu lambat, dan peningkatan cases akan berlaku dengan begitu cepat sekali. Then the other thing is, of course, surveillance. So surveillance, we also have our IR surveillance, our SARI surveillance. One of the things that we did not really do very well is in the genomic surveillance. So apa yang dinamakan sebagai genomic surveillance adalah di mana apabila kita melihat kepada varian-varian yang baru. Jadi kalau kita tahu apa jenis varian yang berada yang sedang merebak, adalah lebih senang untuk kita combat atau mengawal keadaan. So when we had Delta, again, we were not able to know what kind of variant was moving around. So we are still trying to cope with genomic surveillance. We have sites to do genomic testing, tapi tak sebanyak yang diharapkan lah for country like us, right? So we also move to digital contact tracing. So this is initially pada awal-awalnya ada beberapa contact tracing, ada yang pendidikan langkah dari Negeri Selangor dan MySejahtera from federal, but in fact now everyone have moved to MySejahtera lah. So this is our app, digital contact tracing app, our vaccination app. So nowadays kalau kita tak ada MySejahtera di phone itu agak sukar untuk hidup lah. Semua informasi ada dalam MySejahtera. Maknanya sekiranya seseorang tu dah cukup 2 dos, the digital passport will be on MySejahtera. And if you need to, say for example, go to a certain place that needs to verify that you already have your vaccination, so you have to show your MySejahtera. And in fact, if you go to any places, you have to log on and to to scan your MySejahtera. So MySejahtera is quite a powerful app that we need to have in the country right now. Of course, there are issues. In fact, the last 2 days ada isu di mana MySejahtera, some of the MySejahtera people who's holding the app dapat apa dikatakan sebagai pencerobohan. So that is something that I think the ministry is also looking at. And they promised that there was no informasi-informasi yang rahsia tidak terkeluar lah. So some issue when it comes to mental health adalah all these things. So mental health is an issue semasa COVID-19, semasa lockdown ataupun bukan lockdown. Dan Kementerian Kesihatan has a lot of facilities. So the first aid team, what's called as the mental health and psychological support services, was started way back last year. In fact, other Kementerian Pembangunan Wanita, Keluarga dan Masyarakat juga ada. So they've got bantuan warga emas, they've got talian kasih that you can just call up and ask. And of course, PAWE, that's Pusat Aktiviti Warga Emas, is also under Jabatan Kebajikan Masyarakat, under the Kementerian Pembangunan Wanita, Keluarga dan Masyarakat. So it's something that is given to the population. But of course, I'm sure some of you would have known that some of these services tak cukup. So we also had the community to support. So we have the hashtag Kita Jaga Kita. We have the issue where people who were asking for help would just raise their white flag. So there was a time where there was really high number of cases. So people were really out of food, and just raising a white flag in front of your house would also seek support from the community. So, and people came out with apps for you. If you want to help, you are able to do so. So these are some of the things that has been happening in the country. So tertiary education, tertiary prevention, again, this is long COVID. So this is where long COVID comes in. So we already have a management protocol. This is started by the Kementerian Kesihatan. In fact, we are involved with the WHO protocol, and we have translated the WHO protocol in bahasa. So if you are interested, you can just go. I can share you the link, and there is a link on how management ataupun sokongan untuk pemulihan pengurusan kendiri bagi long COVID. This is by WHO dan telah dialih bahasa ke bahasa Malaysia ataupun uh, lebih kurang sama dengan bahasa Indonesia lah. Okay. So another issue that we face is this thing called infodemic. So bukan sahaja pandemic tetapi infodemic, dan infodemic ada dua, misinformation dan disinformation. So this is something that the country was facing in the height of the pandemic, and in fact until now. So we have a kementerian who's really involved in this, and the tagline is jika tak pasti jangan edarkan ataupun jangan kongsi. And in fact, in our department also, we started way back awal-awal dari bulan February, bulan March. We went all out into education and more on education and writing to the media and giving our thoughts on how to improve COVID-19 pandemic. In fact, when the vaccine came, we were pushing for vaccine. So I think the whole department has been doing a lot of work in this last 2 years with regards to this. We went on TV, social media, and we realized that it's not just the print media, tapi the social media sometimes is also stronger. So we went into the social media and did all these activities. I think we're still doing this. So if you would like to know more, just log on to our website. This is the department's website, and you can see all the information that we've been doing in this last 2 years lah, and still doing. So maybe just a brief on the other component that's been highlighted by the United Nations when it comes to impact of COVID-19 to older person, that is on abuse and neglect. And one of the reasons why I am passionate about this topic is because even before COVID-19, my research was on elder abuse and neglect, and maybe another opportunity ataupun another webinar I can describe that in further detail. Tapi because just to describe to you, the issue of elder abuse and neglect is there. Maknanya kadang-kadang agak sukar untuk kita gambarkan bagaimana ada pengabaian, penganiayaan dan penderaan bagi warga emas, tetapi ia berlaku. Dan apa yang kita lihat ini apa ni, newspaper cutting dari tahun 2013. Maknanya ini berlaku even dari dulu lagi. Dan if you don't do anything about it, it's just, you know, hiding it under the carpet. One of the things is that child abuse and neglect, domestic violence, a lot of people have been talking about it, and a lot of activities ada. Unfortunately for elder abuse and neglect, because the older population baru, so banyak masih yang tak ada issues on elder abuse and neglect, and actions are not really taken that well. So our NHMS saw that the prevalence is about 1 in 10, that means 10%. Our own research, we call it the PEACE, Prevent Elder Abuse and Neglect Initiative, juga mendapat lebih kurang 1 in 10 of older adults pernah mengalami pengabaian, penganiayaan dan penderaan warga emas. And one of the important things to maybe I would share is that financial abuse ataupun penderaan keuangan merupakan salah satu yang agak tinggi, dan ini juga kita lihat semasa pandemik. So one of the worrying thing is that financial health and well-being still happens, and it happened before the pandemic, and even during the pandemic people were taking the opportunity, or people are trying to scam warga emas berkenaan untuk mendapat apa their financial. So this is something that was really scary during the lockdown period. And even more worrying is that there is no law on elder abuse and neglect in the country, in Malaysia. We only have the Domestic Violence Act. So the Domestic Violence Act mainly gives protection to spouse. So but it doesn't cover the big scope of elder abuse and neglect, especially financial abuse. It doesn't cover financial abuse. And some of the financial abuse actually happens or was the perpetrator is by the family members. So it's difficult for the warga emas ini untuk melaporkan kepada polis. Of course, we can laporkan kepada polis, tapi the penal act will be the one that covers it. Tapi because of the intrinsic or the difficulties in elder abuse and neglect, this hardly happens. And one of the things that this is our project, and what we have done is the impact out of this project is that there will be a special act for senior citizens or warga emas. So this act was supposed to be ready tahun lepas, but because of the pandemic, we had to extend. So inshallah, if things are okay, maybe at the end of this year ataupun early next year, they will start to get the draft ready, and the process of law is actually quite long. Maknanya the draft has to be ready and then it has to be tabled to the parliament, and then they have to debate on the laws first. So hopefully by then something like this or some form of act untuk melindungi warga emas boleh diadakan di country. And maybe just to touch on the International Day of Older People's team, Digital Equity for All Ages. So this is just a highlight what happens during COVID, during lockdown. A lot of things actually moved to digital. In fact, I think even healthcare also moved to digital. We had some telemedicine or telehealth happen. Unfortunately, for older people yang tak ada, yang agak tidak berapa fasih berkenaan dengan digital world, was left behind. So this was one of the things that actually came out from the team to reduce the digital gap. And like I mentioned, our apps, the My Sejahtera, nowadays you can't go anywhere without the app or without a proof saying that you already have vaccination. So it's going to be difficult. So increasingly we see that the ICT is one of the part that plays with your life right now. And with the digital divide, the older people in Malaysia might be left behind. So this is something that we need to tackle. Just in summary, maybe what I can say is that right now, COVID-19 situation is at manageable level in the country. In Malaysia, you can see that the numbers have declined. Unfortunately, we did not do very well. I think among the countries in Southeast Asia, you can see, you can compare the numbers. Our numbers are really high. Our death due to COVID-19 is also high for a small country like ours. So we have challenges in the healthcare delivery and accessibility. Unfortunately, we were able to respond when the peak of the pandemic. I think we didn't really went into something like what India had, but we were almost there. There were situations where oxygen levels were low, and there were situations where patients were not able to get beds in the hospital. There are also situations where people BID, maknanya they didn't even know that they had COVID and they died at home. So there are challenges in the healthcare delivery when it comes to COVID-19, especially during the Delta peak recently in the country. And then there's also challenges in long-term care setting, especially in nursing home. But like I said, fortunately, alhamdulillah, yang ini tidak begitu ketara sangat di negara kita as compared to countries like in Italy or in France or in US, for example, where you have large number of death among those in long-term care ataupun nursing home. So we need to do better in terms of the policies, in terms of the actions. We really need to have a strong healthcare system. One of the things that we don't have is our public health system is not very strong. We have the same people doing contact tracing. We have the same people giving vaccination. We have the same people doing the surveillance. So I think when it comes to public health or preventive health, lack of manpower is really, really a challenge. We also need a socially responsible population. Maknanya apabila kita telah bagi pelepasan tu, we really have to be following our SOPs. And of course, lastly, we really need to ensure the vulnerable populations are taken care of, which one of them is the warga emas, the older population. So with that, I thank you. I hand over back to the moderator.
Okay, well, thank you so much, Professor Noran. It was really insightful. Your presentation has increased our knowledge a lot. Well, once again, thank you so much, Professor. Okay, well, now we're going to go to our next session, which is a discussion session or Q&A session. So for all the participants who have question, you can drop your question in the chat box, or you can either deliver it directly by an open mic. Okay, once again, dear all honorable participants, in case you have a question, you can drop your question in the chat box, or you can either directly deliver it by an open mic. Okay, while waiting for another question, maybe I have a question for you, Professor. Yeah, regarding your explanation about dementia itself, what is actually the best solution to deal with the high case of dementia, and what is actually the best intervention that we can give as, especially for us as a public health professional, to decrease the case among the elderly, especially in developing countries and in this COVID-19 pandemic?
I think that's a really good question. When it comes to dementia, one of the first few things is, of course, to acknowledge that this is a public health issue or public health problem. What we notice here in the country is that some people, there are population that feels that dementia ataupun apa yang dipanggil sebagai nyanyuk itu adalah satu perkara yang warga emas akan berlaku. So nyanyuk itu adalah sebahagian daripada proses penuaan, which I think is something that we really need to fix that. That is a myth. Again, like what Prof Hazrin mentioned, I also didn't realize just now that your metabolic rate as you grow older reduces. I always thought that that was true, but now knowing and listening to his lecture just now, it's a myth. So Hazrin, if you're there, maybe I can ask you that question. So I never knew that. So again, sama juga, similarly with dementia, ada anggapan di kalangan warga emas dan mungkin di kalangan the healthcare workers to think that nyanyuk itu adalah sebahagian daripada penuaan. So I think the first and foremost, we have to betulkan that myth. So it's not a fact, it's a myth. You don't have to be nyanyuk itu bukan dementia. So nyanyuk does not equate to dementia. And some of the things that we have found in terms of dementia studies is that dementia can actually be improved during the adult stage. So things like physical activity, improving your blood pressure, controlling your blood pressure, maintaining good food and nutrition, these are some of the preventable or modifiable factors that can be taken to reduce the chances of one having dementia. And of course, kalau we look at the bigger picture, if we have a country with action plan on dementia, is very good. Unfortunately, if I can share with you, Malaysia tak ada. We were pushing for that in 2019. We were about to come out with dementia action plan, and then COVID hit us. So I think that had to be pushed aside lah. But this is something that maybe we want to relook again or revisit again. One of my worry is actually in terms of long COVID. Sebab one of the symptoms of long COVID is brain fog. Dan brain fog ini adalah seakan-akan masalah dementia. Jadi sama ada people will recover from brain fog ataupun sama ada the burden of dementia akan bertambah selepas COVID-19, the current situation. I'm not sure. So there are a lot of things that we can do with dementia, but the first and foremost is to remove the myth yang kita anggapkan nyanyuk itu adalah sebahagian daripada penuaan.
Sorry, I didn't hear the whole question, but since you mentioned my name, but I think let's look into it, because I think when you mentioned about brain fog just now for dementia, we also don't know whether the brain fog is temporary or for a long term. So that is also another thing that kita kena consider lah. And then memang personally, I think for some of our Indonesian colleagues know there are more talking about mental health and having enough antioxidants from fruits and vegetables to minimize or to improve your cognitive function. And in fact, now there's a big study which is called the MIND study, really look into having all the what we call nuts and everything, nuts and all the it's an improvised from dash, but more nuts and everything, make it balanced. Also prevent you from having dementia. So I think it is a multifactorial as usual. Come with food, maybe in terms of how sharp, and sometimes maybe with our Asian, right? Kita ni selalu bila dah sampai tua, oh tak apalah dah tua dia nyanyuk. Sometimes being positive thinking is very important, because kalau kita tengok, kita compare dengan certain countries like Japan, kita don't compare with advanced countries which is not Asian. They have problems with dementia as well, but it's not macam saya cakap tadi lah, you look into the problem as opportunity rather than the problem is actually a problem. So I guess as what Prof Noran mentioned just now, yes, there's so many things that can promote to that, but we also have to put a stop, saying that as you are getting older, you cepat nyanyuk. Because I think nowadays yang kalau muda pun you tak sharpen your mind, you pun boleh nyanyuk juga dalam itu, lagi kesian you nyanyuk di usia muda. So I think that's my 2 cents. It's a very interesting, and in fact, if this is something that we want to put in our big research as well, for collaboration, we can start small. In fact, just looking into in terms of between Nusantara, just Indonesia, Malaysia, and how we can actually look into this as well. Yeah, actually banyak benda boleh buat lah.
Hasrin, very good that you're here. Maybe I can ask you the question about the metabolic. You mentioned just now in your lecture that the metabolic rate does not reduce as you grow older. So this is something new that I learned. So
Yeah.
maybe you can elaborate a bit on that.
So this big basically some studies they just published it like a month ago. So basically we always assume after 30 years old you have reduced, anda ada kekurangan kadar metabolisme about 5% every 10 years. Okay, but what is interesting, they look into the kadar metabolisme tu tidaklah betul-betul menurun sampai anda berusia 60 years old. So bermaknanya if you gain weight between 40 to 60 years old, is definitely nothing got to do with metabolism rate. Is your intake and physical activity, is your physical activity going down, and that's why the beauty of new evidence, because we always been told, oh tak apalah dah tua, you punya metabolic rate pun dah rendah. It's actually not correct. So that is something that we have to consider. Kalau untuk for me and Prof Noran lah, we are in Malaysia. Malaysia is leading, especially for undernutrition children, overnutrition children, overnutrition adults. Everything lah under the sun that is not good, Malaysia is leading. But I was just thinking, is there any way that we can reconsider and revisit? Maybe that is our perception as well, or let it be. As we're growing older, let it be. But I think Malaysia dan Indonesia, definitely we cannot run away lah. We are food heaven. Memang saya akui kalau saya pergi Surabaya, memang sangat dijaga, ditatang dengan minyak yang penuh. Makannya sampai ke malam ya. Ibu-ibu bapa-bapaknya, terima kasih sangat. Tapi kita pun perlu slow and steady saja. Okay, that's from ada. In fact, there's so many studies. I didn't mention actually for COVID-19 as well. There's one big studies have shown within the house of people who are having COVID-19, having a probiotics drink is preventing or minimizing the risk of people who are, because before that COVID-19 kan you just quarantine at home. So siapa-siapa yang dalam rumah tu yang ada probiotics drink for certain amount of time, you are actually also boosting their immune system to prevent it, and that has been shown in a big study in the US.
Yeah,
So,
I think to sorry to add on to your improving on the immune system, there's also studies to show that for vaccination, for example, before you maknanya to make sure to maintain your immune system, it's not just to wait lah. You have to be proactive and do something. Yeah, I agree.
Yeah, so banyak sebenarnya. I think Indonesia, if you say just now we more fundings is coming, let's strategize, look into something, because I would like to see more and more papers in the New England Journal of Medicine coming from Malaysia, Indonesia. That's my dream. And I know as a visiting as an adjunct professor, we can provide input, but at the same time, let's make it big. And let's move forward from there, because it's very difficult to actually get into big journals if you are working in silos. Any other question? Tadi saya ni saya sambil berjalan saya dengar sekali lah. Okay, my evening walk before ni. Okay, continue.
So Hazrin is really mengamalkan apa yang dicakap lah.
I have to.
Very good, very good. Ada soalan lain?
I think it was very clear enough, Professor. Thank you so much, Professor Noran and Professor Hazrin, for your explanation. I actually take several notes of your discussion. It was really insightful. It has increased my knowledge as a student. Thank you so much. Okay, maybe I'm gonna remind all the participants here, in case you have another question, you can drop your question in the chat box, or you can directly deliver it by an open mic.
I have a question, please.
Yeah, sure.
Okay, thanks for the chance it's given to me. My name is Willy Balusiga. I'm from Epidemiology Division of University. I want to ask for Professor Noran. Before that, I want to say thank you for the presentation. It's very good to increase my knowledge, especially about the COVID and how we fulfill our nutrition in the pandemic situation. My question is, there are topic I'm so interesting about the mental health. Prof. Noran says about mental health can influence the people who have COVID-19. So my question is, what do you do about this problem about the mental health? We know that mental health can influence our nutrition intake or our immune system. So what do you do to solve this problem, especially in Malaysia? I think we can do the same thing in Indonesia, because mental health is not become a priority in Indonesia. Maybe I think in my place especially. So what do you think about this problem? So that's all. Thank you.
Thank you for the question. I think that's a very important question. In fact, maybe I start off with sharing what are the changes in terms of mental health for older people during this pandemic. What we saw was we did a study, and we saw that about 40% of our older people actually report to have higher depressive symptoms. 20% report higher anxiety symptoms as compared to baseline. Maknanya we did the study before, and then we used the same questionnaire to the same population, and we went there again, and we saw about almost 30% said that they have increase in stress, and all this information actually significantly affect their quality of life. So it is a real thing when it comes to mental health issue. And one of the things that we are also pushing here right now is to focus on living or coexisting with COVID. I don't like the word living with COVID. I think nobody wants to live with the virus. Maybe we want to coexist ataupun seiring lah, berada seiring dengan virus tu lebih tepat. So when we are now moving on to coexisting with the virus, we really have to put mental health into the picture. And one of the things that the government, a big picture the government is actually doing is to come up with the mental health the mental health focus, in a sense that recently, because this month is also the mental health month, so the Minister of Health already mentioned that we're going to have a resource or issues on mental health, in the sense that they're going to have a mental health focus.
Center.
Yeah,
mental health
center. Yes, that's the word. Sorry.
Mental
health center. Tak keluar. Yeah, I know. I got my brain fog. Sebab dah pukul 6 dah lapar. So mental health center is one of the things that they're going to really look at, and activities that happens on the ground. One of the first few things is also to encourage population, maknanya to sedar walaupun seseorang itu mengalami masalah mental, there are two things. It's not just mental issue, but it's also on mental well-being. Maknanya talk encourage people to talk about, to be open about the issues of mental health is one of the things that we push forward. That's one. And of course, clinics opening up for mental health support and mental health treatment is there. And of course, the main thing is, of course, issues on stigma lah. Stigmatization of mental health issues should be removed lah. So that, I think, those are some of the key features. And of course, one of the things yang kita kena beri perhatian juga adalah kepada caregivers, the carers of those people with mental health issues. So this carers is also somebody or a focus that we really need to focus on. Hazrin,
Okay.
anything to add?
You, Willie Baldusiga, is it clear enough?
Yes, yes. I think I have.
Anything you want to add?
I understand it.
Actually, there's something to be added as
Thank you
well.
for sharing.
Noran, I think for the mental health, we also for the first time be recognized in the medical insurance, right?
Yes.
For the seeking treatment and everything. So that is a big leap for 2020 and 2021 in terms of mental health in Malaysia.
I think the focus is again mental health, mental well-being, the psychological support in terms of preventive care and community care. And maybe another component that we might want to think about is the usage of digital health lah. Maknanya using technology to improve mental health, that is a way forward lah. But of course, we acknowledge ada certain parts of the country yang mungkin akan menghadapi masalah sekiranya digital health ini dilakukan dengan begitu meluas. Tapi I don't think it should stop us. Maknanya we should try to use digital support or digital or telemedicine issues or digital health, because like we saw during lockdown, without digital health, even like now, there's always, what do you call it, there's always opportunity in terms of situation. So we should actually use up all this opportunity. So this is considered like an opportunity lah, at least, using digital component.
Agree. We do have for the PPR as well for mental health intervention for future to talk. Yeah.
Cool.
Okay, well, thank you so much, Professor Noran and Professor Hazrin. Okay, to all participants, is there any other question? Okay, I think since we have a really brief time for the session and there is no other question, now we're going to go to our next sessions. Okay, but ladies and gentlemen, before we're going to go to our next sessions, we're going to give the fundal to our speakers today as the appreciation. Okay, the first fundal will be given by our lecturer, Mr. Trias Mahmudiono, to Professor Noran. To the committee, you can do your own screen sharing now. Okay, once again, to the committee, you can do your own screen sharing now to give the fundal to our speakers today. Okay, well, ladies and gentlemen, maybe we're going to go to our next session first. Yeah, there will be a closing speech from our Dr. Lucia Yovita Hendrati, Sarjana Kesehatan Masyarakat, Magister Kesehatan. To Dr. Lucia, time is fully yours.
Thanks, Azara. I say thanks for Prof. Noran and Prof. Hazrin. Take the time for today's webinar. Thank you for an interesting lecture. This material can inspire for research. Yeah. Thank you for attending for participants this webinar. It's hopefully we can take advantage of the material from Prof. Noran and from Hasan. I think say material from Prof. Noran say vaccination is one thing that can solve the COVID-19 pandemic here. Maybe in Indonesia is cakupan vaksinasi ini sudah tinggi dan orang memakai poster vaksinasi mulai naik untuk melakukan vaksinasi poster. Profession in Indonesia, the most selling food integrated during the COVID-19 pandemic are eggs and honey ya. Eggs and honey banyak dibeli orang pada waktu itu dan juga kurkuma ya, empon-empon kalau istilahnya di Indonesia. Oke, Zara, saya kembalikan ke Azara ya.
Okay, well, thank you so much, Dr. Lucia, for your insightful speech. Okay, well, because there is a difficulty in our technique, distinguished participants, okay, well, those are the agendas that we have presented to you today as we finished our webinar of epidemiology. Thank you so much for making time in your busy schedule to join us here. I wish you all a pleasant day. Well, thank you so much, everyone. See you in other opportunities.
You're not taking group photo?
Oh yeah, sure. Yeah. Okay.
That's your usual routine.
Okay. Now we're going to go to photo session first. Okay, everyone, you can open your camera so that we can see your face. Okay, maybe I will do the countdown. Okay, I'm waiting for all the participants to open their cameras first. Okay, for the first slide, 1, 2, 3. Okay, for the next slide, 1, 2, 3. Okay, yeah, I've done the photo session. Okay, well, thank you so much, everyone. Have a really nice day.
Okay, thanks for having us.
Yeah,
Goodbye.
I wish
Have a
you all
nice
a pleasant
weekend.
day.
Thank you, Prof. Noran.
Thank you,
Prof.
Prof.
Azrin.
Nasrin, Prof. Noran.
Selamat
Thanks,
siang.
InsyaAllah kita
everybody.
berjumpa lagi.
Ya, insyaAllah. Assalamualaikum semua.
Yeah, since we finished our
Waalaikumsalam.
webinar, you guys may leave the room now. Thank you, everyone.
Terima kasih.